Hey there, everyone. Today, we're diving into a truly disturbing and thought-provoking incident that has unfolded in the ongoing conflict between Israel and Lebanon. The situation is dire, and it's important we shed some light on what's happening. So, let's get right into it. On Friday night, a devastating strike occurred in southern Lebanon, targeting a medical center and resulting in the tragic loss of 12 healthcare workers. This incident is not an isolated event. It's part of a larger pattern of attacks on medical facilities and personnel, with the death toll among healthcare staff in Lebanon now reaching a staggering 31 in just 12 days. The specifics of the attack are harrowing. Israeli rockets struck a primary healthcare facility in the town of Burj Qalaouiyah, causing a devastating fire and the collapse of the building. Doctors, paramedics, and nurses on duty lost their lives, according to the Lebanese Ministry of Health, who condemned the attack as a violation of international humanitarian laws. Now, here's where things get even more concerning. Human rights groups have unequivocally stated that any attacks on medical workers, regardless of their political affiliation, constitute a war crime. Yet, despite this, Israel has carried out a shocking 37 attacks against healthcare workers and facilities in Lebanon since the current hostilities began. The war itself started on March 2nd when Hezbollah launched rockets at Israel, prompting a swift and intense bombing campaign across Lebanon. Since then, the fighting has escalated, with Hezbollah continuing its rocket fire and Israeli troops invading southern Lebanon. The human cost of this conflict is devastating, with at least 826 people killed and approximately 1 million displaced in Lebanon alone. On Saturday morning, an Israeli military spokesperson made a disturbing accusation, claiming that Hezbollah was using ambulances and medical facilities for military purposes. The spokesperson, Avichai Adri, threatened that Israeli forces would act in accordance with international law if Hezbollah did not stop. However, no credible evidence was provided to back up this claim. The Lebanese Ministry of Health swiftly denied these accusations, calling them nothing more than a justification for the crimes being committed against humanity. This is a familiar narrative, as Israel has made similar accusations during previous conflicts, such as the 13-month war with Hezbollah in 2024, where they also accused Hezbollah of using ambulances for military purposes without providing credible evidence. The implications of these accusations are deeply concerning. Humanitarian groups have warned that such claims could be used as a justification for further attacks on healthcare facilities in Lebanon. Under international humanitarian law, medical workers are considered civilians and are granted protected status, regardless of their political affiliation. Personally, I find it incredibly disturbing that healthcare workers, who are dedicated to saving lives, are being targeted in this way. It raises serious questions about the ethics and morality of this conflict and the potential for further escalation. In my opinion, this incident highlights the urgent need for a peaceful resolution to this conflict. The loss of life and the destruction of healthcare infrastructure are devastating, and it's crucial that we, as a global community, work towards finding a diplomatic solution. So, let's keep this conversation going and raise awareness about the situation in Lebanon. It's important that we don't turn a blind eye to these atrocities and that we continue to advocate for peace and the protection of innocent lives.